So it's important for young people to understand that this is not an old person's problem. This is a problem you need to try to maintain good, healthy lifestyle. So good nutrition, good physical activity to make sure that you maintain your bones and muscles and keep them strong.
Hi, everyone, and welcome back to STEMPOWER, the podcast where we interview top researchers and doctors in all fields of STEM. My name is Simran.
And my name is Ria. In today's episode, Simran and I will be interviewing an expert in kinesiology. She got her PhD from McMaster University and now teaches at the University of Waterloo. For being awarded the Bloomberg Manulife Prize for the Promotion of the Arts of Active Health, the CIHR New Investigator Award, and the Lindsay Fraser Award. Not only that, she also runs her own bone health and exercise science lab. We are so honored to interview the coveted researcher and professor, Dr. Lora Giangregorio.
Yeah, and we'd like to thank you so much, Laura, for joining us today on STEMPOWER. Ria and I are extremely excited to get to know you and all about your work with osteoporosis, bones, bone health, just everything to do with kinesiology. So, Laura, as Ria mentioned in your introduction, you're a doctor in kinesiology, which is the study of body movement. So can you tell us how you got into this field? What has your career path been like, and what do you do specifically?
So thank you for having me today. I really appreciate being here. So to answer your question, when I was in high school, I wanted to be a French teacher. And so I didn't take any science courses. I was a little intimidated by science courses, to be honest. And so I took all of French and I took drama and I took all kinds of arts courses. And then in grade 12, I all of a sudden decided that that's not what I wanted, but I didn't know what I wanted to do. And I was talking about it with my cross country coach, and he asked me, well, what do you like? What are you interested in? And I said, I'm really interested in learning about the body and how it works, and how exercise can improve our health. And he suggested I studied kinesiology, and he described it as the science of human movement. So I looked into it, and what I realized was a lot of people think kinesiology is like phys ed, but it's actually a science program. And in most cases, schools that have kinesiology, you can actually earn a Bachelor of Science. Some of them are a Bachelor of Kin and some of them are a Bachelor of Arts, but a lot of them have a Bachelor of Science in kinesiology. And rather than sort of taking the breadth of science courses like science of sort of animal biology and invertebrate biology and all of the science courses are focused on human physiology. So it's really like a science degree, but focused on humans. And you get to take anatomy, and you get to take physiology, you get to take neuroscience and biomechanics. So if you're really interested in health or a health profession, it's a really good program. And in fact, people often think you have to do a science degree or a biomedical science degree to get into med school. And in fact, kinesiology is a great starting point for health professions or just people who are interested in human physiology. And so many of our students that take kinesiology in undergrad often go on to medical school or health professions.
I think that's really interesting because from everyone that we've been hearing about, they've always known from the start, oh, I want to do science. And they'd always be like, oh, whenever I'd have the chance to go to the hospital, I'd take it and I'd love it. And I think it's really awesome that you found your interest in a different area from your cross-country coach, as you said. I think that's just like a great way to start, and it really shows how you can really find your career or your interest in so many different areas, and I just really love your story, so thank you for that.
Well, the other thing I'll say is I didn't actually decide that until towards the end of high school, and I ended up having to kind of go back and take a lot of those science courses so I could actually be eligible to get into the program. And it was worth it. So I was able to go back and take a few, like I didn't, when I was in high school, there was an extra year. So we had OAC. So it was like a kind of a grade 13 sort of. So I actually had the time in my degree to go back and take them. So I was quite lucky. I think now it'd be a bit harder, but I do also know someone who, went to university for accounting, and then it was in university for a term and realized they didn't like it and wanted to go into kinesiology. They went back to high school, took the courses and came back, and now they're a chiropractor and they're really thrilled with that decision. And I think the other thing to think about is you're pretty young, when you're in high school, and you have to make some pretty big adult decisions, and it's okay if you change your mind. You have time to go back and do something different. And I didn't decide in high school that I wanted to be a university professor. And in fact, I didn't even decide in university. When I was in university, I thought I wanted to be a physiotherapist because everyone in kinesiology seemed to want to do that. So I thought, okay, well, maybe I do too. And then I volunteered in a physio clinic and I really didn't like it. So I tried lots of different things. Like I worked as a personal trainer, and I worked as a student ergonomist, and worked with the rugby team as a student athletic therapist. I tried all different things and nothing really seemed to fit. And it was only in my last year of university, when I did an honors thesis with a researcher in my last term, that I realized, wow, I really like this and I want to be able to do more research. So I decided to do a master's, again, still not knowing that I'd want, end up as a university professor. I just was like, I just want to stay in school because it's interesting. And so went on to grad school, and then ended up sticking around and doing a PhD, mainly because I just really liked what I was doing. Not because I had this vision of what I wanted to be when I grew up. And it just sort of kind of happened that my life went in this direction, and then it worked for me. But so I guess my advice to high school students would be, don't worry too much about what you're going to be when you grow up. Just think about what are the big world problems that you're interested in solving, and what steps can you take in your learning to move towards solving those problems. So what courses can you take, or what volunteer opportunities can you take that align with kind of the things that interest you? And eventually you're just shiny doors will pop up in front of you, and you just walk through the one that's the shiniest, that's the most interesting, the one that really, compels you and helps you understand how you're going to learn more, I guess, is the way I would put it. Because I think a lot of students get very anxious about making these choices. And I think, if you don't worry too much about where you're going to be at the end, then it might be a bit easier. I don't know if that helps.
That definitely helps, Laura. It's really inspiring to see, like, even though like you and maybe your colleagues, you might not have set out on this path, but you ended up succeeding in whatever it is you did. And I think that's like a really important thing, especially our listeners who are like high school students who might not be super sure where they want to go. We still have that hope. Like, you don't have to make all the decisions when you're 15. So I think that's really reassuring.
Yeah, no, you don't. And I didn't really know what I wanted to do. And I think it's very rare. And I actually also think there's people who have their mindset that they're going to be a doctor or going to do this, and then it doesn't work out for them. Right. So I also think you have to be a bit open to other possibilities as well, and not always assume your life is going to go in one direction.
Yeah, no, that's definitely valuable advice that I'm sure myself, Simran, and our listeners will really take with us. So you ended up in kinesiology, even though your path might have been a little bit trying everything and finally figuring it out, and you became a doctor in it, which is really inspiring. So when we did some research into like what's the field of kinesiology, like you said, it's like human body bone movement. So there's a whole bunch of like bone related ailments that people think of, like, oh, you're breaking your arm, you're getting a fracture, you osteoporosis. So how does, like, a lot of our listeners who are listening in on this, the worst they might have had bone related was they might have broken a limb playing sports. But I know that age can also play a lot of a factor in people's like susceptibility to these kind of musculoskeletal conditions. So how does that factor in, and what can we as young people, even taking care of maybe our parents or our grandparents, keep in mind about these kind of conditions?
Yeah, no, it's a really good question. I've heard osteoporosis referred to as a pediatric disease with geriatric consequences. And the reason why it's referred to that way is because you develop bone and grow throughout childhood. And the time when you're around puberty where you're growing the fastest is when you're gaining the most bone. And then as you get to, your 20s, you pretty much have the amount of bone you're going to have as an adult. And it's very hard to increase your bone mass a lot beyond that. So your greatest potential for building bone strength is actually as a preteen or early teenager. And so it's the decisions you make now that actually influence your bone health that you're going to have as an adult. Like, there is some leeway. So there's definitely, maintaining good decisions during adulthood is also important, but making sure that you get adequate physical activity and have good nutrition, good protein, good calcium intake. Those are all things to try to maximize your peak bone mass. And then as an adult, basically you have a certain amount of bone mass that you reach, and it may fluctuate Some people can increase their bone mass a little bit during adulthood with different things, but in general, it stays about the same until you're around 40, and then you start to lose a little bit of bone mass over time. And then other things can cause people to lose bone mass. So certain medications, certain behaviors, certain health conditions can cause you to lose bone mass. So it's really important to do what you can to maximize it, and then to think about the things that can influence your bone health. So for example, people think of osteoporosis as a old person's disease, and often an old woman's disease. And in fact, men can also get osteoporosis, and young people can get osteoporosis. So there's a story of a young female runner who, was really pushed to run faster and to lose weight so she would be lighter. And unfortunately, that also meant she was losing bone mass, and she, had osteoporosis at a very young age. So it's important for young people to understand that this is not an old person's problem. This is a problem you need to try to maintain good, healthy lifestyle. So good nutrition, good physical activity to make sure that you maintain your bones and muscles and keep them strong. But as we get older, we do lose bone mass. And then when hormone levels start to decline in women and men with age, and women have a large decline in hormone levels at menopause, we also lose bone related to that. So those are things that you can't control. You can't, unless you take medications to replace hormones, you do have those changes. So people will lose bone mass, and they're much more likely to have osteoporosis as an older person, but not all older people have osteoporosis. So there's certain people that are more at risk than other people, and it often relates to their genetics, their physical activity, other health conditions they may have, medications that they've taken, their sex, their weight and height. So several different risk factors can influence your risk.
Yeah, I think that's really interesting. The point that you brought up at first, how people our age, like teenagers, young adults, it's really this time where we can determine how healthy our bones are going to be in the future. And I think that's really important for people to realize now so that they continue and maintain the health that they have for their bones. And I was actually reading a few days ago how there's something called juvenile osteoporosis, which it's basically when it's really rare for young people like adolescents and toddlers to develop osteoporosis, but when they do, it can usually or sometimes just be caused by some type of underlying medical condition. And I think that it's really good that people really need to know that it's not just something that old people are affected by. It's something that we can be affected by, and we just really need to focus on ourselves and keeping ourselves healthy.
I know it's true. I was just going to say, one of the behaviors that is known to cause low bone mass is eating disorders. So people who have relationships with foods or their body image such that they try to maintain a really low body weight. And if you think about your body is made up of sort of, muscle, bone, and fat, when you lose body weight, you lose a little bit from each of those compartments, right? So you will lose bone mass when you lose body weight. And so people who yo-yo diet, right, where they lose weight and gain it and lose weight and gain it, you may be losing bone during those periods, and you may not gain it back as quickly if you do gain weight. So it's paying attention to those behaviors that, that those things can actually influence your bone mass and bone strength.
Yeah, and I think it's really important that you mentioned all of that, because that's something that like older people can deal with, but a lot of young people, especially my age, deal with that. And it's super important that they know the side effects of what they're doing to themselves, and how it's really more important for your overall health more than just focusing on one certain part of your body. Now, Laura, I read that you have a lab called the Bones Lab, where the E and the S is capitalized, for bone health and exercise science. So can you talk about what kind of research you're conducting and what are your goals in this lab?
Yeah, thanks. That's it's really great that you guys have done so much reading about what we do. I'm honored. We kind of have three main goals. So one of our goals is studies that help us identify people who are at risk for fractures. We do studies that look at testing interventions that are effective for improving health outcomes in older people, and then studies that help us understand how to effectively communicate science related to physical activity to healthcare providers and the public. So sort of those three aims. So for the first aim, we're often looking at big data sets and trying to identify risk factors or identify things that are associated with fractures. Or identify things that influence physical activity, for example. So for example, there's a study called the Canadian Multi-Center Osteoporosis Study, and they have data from almost 10,000 people across Canada. And colleagues of mine have done studies looking at risk factors for osteoporosis using that data. And we're currently looking at some questions around physical activity and fractures using that data. For the second aim around interventions, we want to know what types of exercise interventions are effective for improving health outcomes. So that might be, for example, we have a trial planned to start next year to look at the effect of resistance training on bone mineral density, which is a measure of bone strength, in people who have low bone mass. So a lot of the studies that have been done are often in people who are somewhat healthy and don't have normal bone mass. So we actually want to test resistance training in people who are over the age of 50 who have low bone mineral density. And we're going to test both moderate intensity resistance training and high intensity resistance training. And so that'll be a clinical trial that we'll run, and we'll recruit 300 people and do resistance training for a year and have a control group and look at what the differences are. And then the other objective is effectively communicating science to healthcare providers and the public. So that would be things like developing guidelines for managing osteoporosis or for physical activity. So guidelines like the Canadian 24-hour movement guidelines. And I'm also working with Osteoporosis Canada on their guidelines for exercise for people with osteoporosis. And we'll do studies where we try to understand how to better communicate the guidelines to the public or research to the public, and then we'll develop interventions. So we'll work with Osteoporosis Canada on, patient information tools or communication strategies for healthcare providers.
Wow, that's fascinating. There's so many goals for one lab. You guys are able to not only do research of your own, but also bring more awareness to the general public. And I think that's a really important thing in science, because no matter how much the scientists know, if the general public doesn't catch on to it, we might not have as big of an impact. But I really think that's a fascinating work that you do at your lab. So not only do you have your lab, but you also help out in the community as the Schlegel Research Chair in Mobility and Aging. So from what I understand, you've been working with elderly people to keep their bones healthy as they age. So what has that experience been like?
So the position, the Schlegel Research Chair in Mobility and Aging is a position as part of a research institute. So it's research that I do working with Schlegel Villages and the Research Institute for Aging. So the Schlegel Villages is retirement homes, long-term care facilities, and seniors apartments that are owned by Schlegel Villages all over Ontario. And they have a strong commitment to sort of integrating teaching, research, and practice. So real world research environments and teaching in those environments. And so I work with them on research. And it's really great because you get to work with the people who are working in those environments and understand what questions are important to them or what questions are important to residents. And I'd say overall, my career in research has been really fun. And the best thing about a career in research and teaching is that it's never boring because you're doing so many different things that you're learning new things all the time. So it's kind of like being able to constantly be a student and learn all the time, but it's your job, which is really fun. I get to come up with ideas for research and test them. I get to work with undergraduate and graduate students and watch them learn and help them learn and grow. I get to do research and teaching with people in the community. I get to meet really interesting people, and I get to do work that helps people with osteoporosis learn how to manage their disease, which is really rewarding.
I think that's awesome that you're able to work straight, directly with people in retirement homes and answer their questions directly, because that brings so much transparency to all of this. And it's really important for our elderly population to know what you and other researchers are doing for them and how your research is impacting them. And I think that's just incredible. And it's really interesting and rewarding work. Now, Laura, based on your publications, we read that there is a strong link between bone health and brain health, and that patients with neurological conditions like, say, Parkinson's disease and multiple sclerosis are more prone to developing bone diseases like osteoporosis. So can you talk a bit about the relationship between bone health and brain health and how they impact one another?
Yeah, that's a really great question. You guys have really done your research. So if you think about bone, people often think about bones as sort of these inert structures that are in our bodies that hold us up. And in fact, they are living tissue, and they have cells, and they have a blood supply, and they have a nerve supply. So, the nervous system is actually directly connected with bone. And there's research to suggest that our nervous system may actually regulate some aspects of bone metabolism through a variety of pathways. So there's things like leptin and serotonin and adiponectin, neuropeptide Y, all these different things that can actually influence bone metabolism. And that's fairly recent research. So there's a lot of basic science research looking at these sort of nervous system and bone or brain bone axis kind of interactions. And it's really fascinating. It's not work that I do because I'm not a basic scientist, but I'm aware of this body of research and kind of how fascinating it is, as you mentioned. And, we know, for example, that there are medications that people will take to regulate the autonomic nervous system, for example, for heart problems like beta blockers. And we know that, in fact, people who take those medications, they can influence their fracture risk and actually have a slight reduction in fracture risk related to taking these medications because of their effect on the autonomic nervous system. So that helps us know that, some of this basic research is actually, makes sense, right? Because there are these pathways these nervous system pathways that can regulate bone. The other thing to think about is that when someone has a condition, a neurological condition like Parkinson's, multiple sclerosis, or spinal cord injury, those conditions all cause less movement in some cases paralysis. And so when our bones, regular loading of bone through either impact, like, when you're walking, you come in contact with the ground, and there's a force on the ground, and there's an equal and opposite force on your foot. So that's an impact load on your body. And those impact loads and muscle pull on bone actually stimulate bone cells. And in fact, we need that stimulus for our bones to stay healthy. And so if you have a neurological condition, you also have reduced physical activity levels and reduced pull on bone related to less activity or paralysis, which can also affect the health of the bone. So you kind of have two things. One is this sort of direct link between our nervous system and bone. And the second is an indirect link because we have less physical activity because of the neurological condition. This can also affect our bone.
Wow, that's so complex. Like, people think that you're going into kinesiology, or you're going into muscle science or brain science, and it's just all so specialized. But then when you step back, you see that the human body is just one big working machine, and it's also connected. So I think that's really insightful research that's being done to really connect how bone health and brain health are connected. And that's, like, obviously it seems obvious, right? Your brain tells your bones what to do, but then if you look back and you look close, it seems like, wow, there really is a connection here, and we can help a lot of people. So that's really insightful. Mm-hmm. And I think we were speaking a bit of your publications. So, Laura, you also recently did a study called Understanding Adverse Event Reporting in Resistance Training Studies. So the gist of it was that it explores people with pre-existing conditions like hypertension, arthritis, osteoporosis, and then how they can be more harmfully affected by strength training. So how did that study go, and what were your findings?
Well, first I want to say it's actually not about strength training being more harmful. And in fact, I would say that strength training is beneficial for the vast majority of people. So it's not necessarily more harmful for people with health conditions. What we do know is that the people who do strength training studies, or at least who've done them in the past, the reporting related to harms is not done very well. And I think a lot of that has to do with the fact that they're not really using clinical trial methodology that's used sort of with drug trials, for example. And we're trying to improve that. So we discovered this because we were working on guidelines, the Canadian 24-hour movement guidelines, and doing research, looking at strength training studies, and we were finding a lot of that information was missing. So we're not necessarily saying it's more harmful. It's just saying we don't have a lot of information about it. We don't think it's more harmful. There's certainly not a lot of evidence to say that it is. And I will say that, so the study that we're actually doing is talking to people who've done strength training and been injured to understand their experience, and then talking to research who've done those types of studies about sort of the barriers or to reporting harms, or what could we do to do a better job. And the idea is to actually use that information to develop a guide or a tool to help improve reporting in this field. So that study is actually still ongoing, so I can't tell you what the results are, but I can tell you that we're learning a lot about kind of what motivates people when it comes to reporting, and kind of what their understanding is about reporting harms. And hopefully we'll be able to develop a tool that's helpful and can improve the quality of reporting in the field.
Yeah, I think that's a really fascinating study, and I'm super excited to see what you guys find near the end. Now, we are a bit short on time, so I'll ask this one question, and then we'll ask one more after this one. So, during the COVID-19 pandemic, we can see many people are now studying from home and just working from home in general, which has resulted in posture problems and muscle pain due to the extended periods of sitting. And on top of that, the recent closures in parts of the country have resulted in physiotherapy or chiropractic services being closed. So how would you say has the pandemic affected people's bone health, whether they be our elderly population or even people young like Ria and I, as well as yourself?
I mean, I haven't read any studies specifically on the effects of the pandemic on bone health, and I suspect this would be something that we won't find out for many years. But we know that, so Canada's 24-hour movement guidelines say that we should get 7 to 9 hours of good quality sleep, no more than 3 hours of recreational screen time, and no more than 8 hours of sedentary behavior, and that we should participate in more physical activity, and in particular get 150 minutes of moderate to vigorous physical activity and strength training twice a week or more. So that's kind of the recipe for, healthy living. And we know that during the pandemic, people are binge watching Netflix and getting a lot of screen time, and not leaving their house. So they're by not leaving their house, they're not getting in their car and walking places and walking with their friends or doing things that they used to do. So they're getting less physical activity, likely getting more work-related, school-related, and recreational screen time, and lots of sedentary behavior. And probably there's a lot of people who are also not getting good quality sleep because they're either anxious or, they're stressed about the pandemic, or perhaps, the screen time is affecting their sleep, because I know it does mine. And so all of these things can affect our overall health, and likely potentially also our bone health, if we're, especially the low physical activity. So that's kind of what I worry about long term. I worry about older people in particular, because when we age, we lose muscle and bone, and now you're having this layer of sedentary behavior. And so I worry that people will lose muscle to the point where they actually lose their capacity to function and live independently, or their fall risk increases because their balance becomes poorer and their muscle strength is poor. They can't react as quickly, and they're more likely to fall and fracture, which can then result in a loss of independence, pain, a lot of disability. So those are the things I worry about in the future. And I think that we will start to see those things in the years to come, unfortunately. So what I would say to your listeners is to encourage them to get good quality sleep, 7 to 9 hours. Pay attention to how much screen time you get, recreational screen time as well as school-related screen time. So no more than 8 hours of sedentary behavior in a day, and no more than 3 hours of recreational screen time. Increase physical activity, get 150 minutes or more of moderate to vigorous physical activity a week, and take up strength training and try to build muscle strength at least twice a week or more. And as we get older, this advice doesn't change. And in fact, strength training and physical activity are even more important. And we also need to do things to challenge our balance, because our balance can deteriorate without us realizing it.
Wow. So it seems like this amount of sedentary isolation from the pandemic, as much as it's doing good for society, on an individual level, we all still need to take care of our health regardless of whether we have COVID or not. And that's really important. I remember, I think we emailed you, and in your email signature, there was a really, really good graphic that I read through about all the things that you just said, like how you shouldn't stay sitting for too long, strength training, exercise, sleep being super important. And I thought that was really interesting. So I shared it with my mom, actually. And I think that's really important, like not only just for teenagers, for adults, like all age groups, especially since school and everything that we used to be doing outside is now being forced to be doing on a screen. And we really do need to keep track of our screen time. And that's an important note.
Well, the irony is that, so I worked on Canada's 24-hour movement guidelines with a group of wonderful people, and it was released in October 2020. And I don't think it got the news that it probably would have got if COVID-19 wasn't dominating our news stories. And so probably not as many people are aware that we have these new movement guidelines. And so I'm glad that you noticed that graphic, and people can go to the CSEP website. If they Google Canada's 24-hour movement guidelines, they should come, and there's guidelines for, kids, for teens, for adults and older adults. And they're all fairly similar, although the kids ones are a little bit different, but they can look them up if they want more information.
Yeah, and I think everything that you were saying and everything in that graphic, for people that aren't able to see it, like our listeners, but everything that you were saying about sleep, exercising, even taking up strength training, which a lot of people don't really think about, but it's really something that people should start doing. And I actually started during the pandemic, and I have kind of noticed that I do overall feel stronger, which was my entire goal, and I'm really happy that I started that. And like you said, and what I'm saying to our listeners as well, is you guys should definitely start strength training and all of that type of stuff, because you're overall just gonna feel really good. And Laura, thank you so much for that great advice, and once again, just thank you so much for joining us today on STEM Power and just sharing about your work and your experiences with the overall body and kinesiology with Bria and I, as well as with our listeners.
I really appreciate you having me. It was a pleasure.
And lastly, thank you everyone for tuning into this week's episode of STEM Power with professor and researcher in kinesiology, Dr. Lora Giangregorio from the University of Waterloo. Be sure to check us out on all social media platforms at STEM Power Ottawa, and we hope you have a great rest of your day.